Hi, guys, and welcome to part 2 of Understanding Anxiety Disorders. My name is Gilles Brito. I am a hypnotist, coach, and psychotherapist that lives and works in Sudbury, Ontario, Canada. And we're just going to continue our discussion. We finished last on obsessive compulsive disorder and the loop that creates it. So this time we're going to cover a little bit more about PTSD. So post-traumatic stress disorder is a type of anxiety disorder, and it can occur after the person has witnessed a traumatic event that caused serious injury or death. Now, this is one of the areas that I specialize in and working with first responders here in my practice. So this is an area I'm very familiar with. So what the person usually struggles with is kind of this reoccurring thoughts or nightmares about what happened during the event. One of the most common criteria is just that they have this serious difficulty in sleeping, falling asleep. Sometimes there's changes in appetite, but they experience anxiety, fear, especially when exposed to situations that are reminiscent of the trauma. So that could be as simple as by driving past the area which they had the trauma. So for certain the paramedics that I work with, if they had an incident on a certain street, they have great difficulty going past that street and not experiencing the physical symptomology of anxiety and distress. So oftentimes they're on edge, jumpy, they can become very startled easily. It's like they're on hyper alert all the time. They often have very low energy. It can really affect their mood in terms of being sad. Staying on task, memory problems, memory difficulties is also very common. It's like there's always interference with the brain from the old past events. The common thing that they kind of talked about is just this feeling of being scattered, that they have difficulty kind of focusing on anything. It's like their attention is all over the place. They can't really focus on one thing. Things get kind of overwhelming really quickly. Even simple daily tasks that they used to do really well. They become much more hesitant in terms of making any big time decisions. They just become very hesitant in doing so when they were always kind of take charge before. And obviously with all the symptomology, you get frustrated, you get agitated, you get angry because you're just not really yourself. The last component is just this feeling of apathy, just feeling numb. They're become totally detached from their emotions, and it just feels like they're kind of going through the motions and feeling disconnected from those that typically would really matter. Now, there's a real coexistence that exists between both depression and anxiety. So about 50% of the people with anxiety disorders also experience depression. So you see the kind of the link between the two here in this graph. So in anxiety, there's a hyperarousal, and with depression, there's a lack of enjoyment. But between the two is this general distress. Now, probably the best way I can illustrate that is I had a client who came in who had gotten the diagnosis of depression. But when I looked at his scores on a tool that I use in my office, it was actually his anxiety that was so much higher. And I said, how does your anxiety play into the depression? And although he kind of wanted to dismiss the fact that there was some anxiety there, because he said, well, I have depression, I don't have anxiety. But I said, no, I understand that because you got a diagnosis from a physician, I get that. But how do they interplay? And he's like, well, a good example I can give you is this morning I wanted to go to our local coffee shop, our local Tim Hortons, to get a coffee. And because there was a line up there, I was so stressed out. I was thinking what other people were thinking about me and all that kind of stuff. And my negative thoughts led me to just think really negatively about myself. Like, that's why you're such a loser. That's why you can't be home. That's why you don't have a girlfriend. That's why you have trouble maintaining a job. And it really led to him feeling really low about himself. So he talked about the fact if we could use some strategies to tackle your tackle your anxiety, how do you think that will impact your depression? And it was like a flash of insight, like, maybe I've been addressing the wrong thing all along. And I says, no, I mean, you've been diagnosed with that. It doesn't mean that it's not there. But if we start tackling the anxiety a little bit more effectively, maybe it can alleviate some of the symptoms of depression that you may have because of those automatic thoughts that you're having. And that was really enlightening for him. So Know that there's, with depression and anxiety, like if you take cognitive behavioral, I think there's 50 different techniques to deal with anxiety and depression. CBT is actually the best practices approach in dealing with anxiety. But it's really any kind of exposure or exposure type of therapy. So that could be EMDR, that could be hypnosis. It could be a lot of things that help a person overcome that anxiety. So that's it. That's my message for today. I hope that this has been helpful, beneficial to you. Like I said, I'm going to do a follow-up videos about treatment in the weeks to come. So look forward to that. Thanks for joining me today. I would love to hear from you. I'd like to answer questions that you may have as it pertains to anxiety or any other issue or concern that you may have. I'd love to hear from you. With that, thanks so much for joining today, and have a wonderful day.